supply of the head and neck, and then I'll pass you back to Harut, who will go through the venous drainage of the head and neck. All right, let's start with the aortic arch. As we can see here, there are three branches of the aortic arch in normal anatomy. So first we have here the brachiocephalic trunk or innominate artery. The second branch is our left common carotid artery. And the third branch is our left subclavian artery. The brachiocephalic trunk then splits into our right common carotid artery and our right subclavian artery. Both common carotid arteries on either side will go up and then divide into the external and internal carotid arteries. And both subclavian arteries will go laterally and give rise to this vertebral artery on either side. A common normal variant to be aware of is the bovine arch. And as you can see here, instead of three, we only have two branches from the arch of the aorta. And that's because our brachiocephalic trunk, as we saw earlier, has a common origin with the left common carotid artery. You can see that quite nicely here in this sagittal image. Here is our brachiocephalic trunk, left common carotid sharing an origin, and our left subclavian is separate. So we'll talk about the vertebral artery in a little bit more detail. The vertebral artery has four segments. It starts off here with V1, the preforaminal segment, as it arises from the subclavian artery to enter the C6 transverse foramen. And then as it goes up through the transverse foramina, it is our foraminal segment. It then exits the C1 transverse foramen, curves around the atlanto-occipital joint, and pierces the dura. This is all in the extradural segment. And finally, the intracranial segment is, as it goes through the foramen magnum, travels behind the clivus and reaches the other vertebral artery to join and form the basilar artery. So here's another diagrammatic representation of this. We can see our two vertebral arteries coming up to join here to the basilar, but just before they do this, typically from the vertebral artery, we have this branch here. This is our posterior inferior cerebellar artery. And then our vertebral arteries join to form the basilar. So let's go through the branches of the basilar artery. First, we have here our anterior inferior cerebellar artery. So differentiate this from the posterior inferior. They're both inferior, but one is posterior and one is anterior. As the basilar ascends, it gives off these smaller perforating pontine branches. And then here we can see our superior cerebellar artery at the top, just before the basilar divides to form the left and right posterior cerebral artery. This is a DSA image, so digital subtraction angiography. And what that is we've taken away a pre-contrast image from a post-contrast image. So all we're left with is the vessels, which allow us to better visualize them. And again, we can see here our two vertebral arteries with our posterior inferior cerebellar artery branching off first before they join to form the basilar artery. We can see our anterior inferior cerebellar artery coming off here. The pontine branches are a little bit more difficult to see. Then we have the superior cerebellar artery just before it divides into our posterior cerebral artery on either side. So the circle of Willis, this is where the posterior and anterior circulation unite. And it's really clever if you think about it, because it allows for stabilization of pressures, as well as it provides an alternative route if there's any blockage anywhere. So the final segment of our internal carotid artery gives rise to the posterior communicating artery on either side. You can see that here and here on this angiographic image. And that joins to the posterior cerebral artery that we were talking about earlier, uniting our anterior and posterior circulations. Our internal carotid then divides into two terminal sections. So that is our middle cerebral artery, which goes laterally on either side, and our anterior cerebral artery, which you can see coming forwards on either side here. And our anterior cerebral artery is united by this anterior communicating artery, closing our circle at the top. So a little bit more detail again. The middle cerebral artery has 4 segments. So we'll start off here. When it bifurcates from the internal carotid artery, it is M1, the horizontal segment. Then M2, the insular segment, starts from when M1 bifurcates. Here at this genu, you can see it becomes a superior and inferior trunk. M3, the opercular segment, starts at the top of the sylvian fissures and goes around this frontoparietal operculum. And finally, M4, the cortical segment, travels over the lateral surface of the hemisphere. So let's look at that here again in these angiogram images. Here we can see our middle cerebral artery. This is the horizontal segment coming around here, and then it bifurcates into M2. And these are the segments that you'll most likely be asked on in the exam. Our anterior cerebral artery, however, has 5 segments. So our first segment, the pre-communicating segment, starts from the bifurcation of the internal carotid. And here's our anterior communicating artery that we talked about earlier. After that joins, we have our A2 segment, the post-communicating segment. We can see that here, this is another DSA image. So here is our A1, and here is our A2 segment after the anterior communicating artery. The callosal marginal artery is the largest branch from the anterior cerebral artery, and it courses within or posterior to the cingulate sulcus. Our posterior cerebral artery also has 5 segments. And once again, here we can see P1, the pre-communicating segment, from when it originates from the basilar artery. And after the posterior communicating artery joins, it becomes P2, the post-communicating segment, as it goes around the midbrain. So once again, here in this digital subtraction image, P1 up until the posterior communicating artery joins, and then as it goes around the midbrain, it is P2, the post-communicating segment. So the vascular territories are quite important to know about as we report these images. So we'll go through them briefly. You can see the anterior cerebral artery is in, its territory is in green, and that supplies the medial part of the frontal and parietal lobe, the anterior part of the corpus callosum, and the basal ganglia and internal capsule. The middle cerebral artery territory is in red, and that supplies the lateral surface of the hemisphere. And the posterior cerebral artery is in purple. So posterior thalamoperforating arteries branch off the P1 segment and supply the midbrain and the thalamus. And then we have cortical branches which supply the inferior medial part of the temporal lobe, the visual cortex, and the splenium of the corpus callosum. We'll go through these internal carotid artery segments, and this is quite important for you to learn in your exam as well, because you could get an image being pointed to any one of these segments, and the question might be, name the specific segment of the internal carotid artery. So let's go through them. We'll start here. C1, the cervical segment. So that is after the bifurcation of the common carotid artery all the way up to the carotid canal opening. And there it becomes C2, the petrous segment. This is as it runs through the carotid canal anteriorly and medially. Then C3 here is our lacerum segment, and you can recognize this because it comes up here at this right angle that you can see. The lacerum segment runs along the superior aspect of the foramen lacerum, but it does not go through it. Here is our C4 cavernous segment as it goes into the cavernous sinus. It then comes around and does this loop that you can see here. This is as it's going around the anterior clinoid process. And so as you expect, C5 is going to be our clinoid segment. It then loops backwards posteriorly and becomes C6, our supraclinoid or ophthalmic segment. And finally, C7 is our communicating segment, and that's where we get our posterior communicating artery branching off our anterior choroidal artery, as well as it then divides into our anterior and middle cerebral arteries. Now going to pass you back to Harut.
Amazing, thank you, Alicia. So now that we've seen the arterial supply of the brain, let's take a look at the venous drainage. So the brain is drained through cerebral veins and cerebral dural venous sinuses. Let's take a look at those. So, do I have control of the slides? Yep. So starting with the dural venous sinuses, these are channels between the two layers of the dura, between the endosteal and the meningeal layer, where blood basically will be drained. And unlike all other veins, they don't run parallel with arteries. They are just coursing on their own here. And they are the major drainage pathway, and they both end up in the internal jugular veins on either side, and that's how the venous system is draining the brain. Let's take a look closely at these venous sinuses. So first of all, we have some unpaired sinuses. This includes the superior sagittal sinus, the inferior sagittal sinus, the straight sinus, and the occipital sinus. There are two additional sinuses, the posterior and anterior intercavernous sinuses, which are smaller and less important on imaging, so we won't cover those, but just for you to be aware of them. And we also have paired sinuses, which are the transverse sinuses, the sigmoid, the superior and inferior petrosal sinuses, and the cavernous sinuses, which I will cover in a few minutes. The sinoparietal sinus and the basilar venous plexus are also there, but also less important on imaging and for the exam. So I also recommend you read up on them, be familiar with them, but for the sake of this presentation, I will not cover those. All right, let's take a look first at the superior sagittal sinus, which is the largest dural venous sinus, and it runs in the sagittal plane in the superior aspect of the falx cerebri, as highlighted here on this diagram. It terminates at the confluence of the sinuses, which can be located at the internal occipital protuberance, where we also have an external occipital protuberance, which you can feel on your head. This will receive the blood from the superficial cortical veins as well, from both cerebral hemispheres, and drain it all the way to the confluence. Let's take a look at imaging and what that looks like. So we have here the three planes. We have the arrows pointing to the superior sagittal sinus on how it would look like on a sagittal plane, on an axial plane, and on a coronal plane. And you can see how it looks a bit triangular on these two images. So that's superior sagittal sinus. Next, let's talk about the inferior sagittal sinus, which is parallel to the superior sagittal sinus, but it runs along the inferior edge of the falx cerebri, and it drains into the straight sinus, which is found at the junction between the falx cerebri and the tentorium cerebelli, and it receives not just the inferior sagittal sinus, also the great vein of Galen, and it will continue to run posterior inferiorly to join at the confluence of sinuses. Let's take a look at that as well. So we have this diagram here that shows us the inferior sagittal sinus, the straight sinus, the vein of Galen, and they are joining here at the confluence of sinuses with the superior sagittal sinus. Okay, so what is this vein of Galen? Let's take a look at some internal cerebral veins and understand what is happening in this region here. So we have internal cerebral veins, which are paired paramedian, so they're on either side of the midline, and they unite with these smaller veins that are over here, which are called the basal veins of Rosenthal. So the internal cerebral vein plus the basal vein of Rosenthal together, they join to form the great cerebral vein of Galen. And then you will have the inferior sagittal sinus, which will drain with the great vein of Galen at the straight sinus. So they join together at this confluence over here. So what does that look like on imaging? We have another venogram here looking at the mid-sagittal section. We have the superior sagittal sinus. Parallel to it, we have the inferior sagittal sinus. Here we have the internal cerebral veins, and let's just get our arrows up. So inferior sagittal sinus. This is the internal cerebral vein. It is joining here with the smaller veins that we're seeing part of. We're not seeing the full extent of the basal vein of Rosenthal. And together, the confluence of these two internal cerebral vein and basal vein of Rosenthal would be the great cerebral vein of Galen, which receives the inferior sagittal sinus and continues as a straight sinus to the confluence. Next, we have the occipital sinus, which is one of the smallest dural venous sinuses, and it will lie on the inner surface of the occipital bone. So here we have a sagittal and a coronal view, and we can see the occipital sinuses on either side as small sinuses. Okay, now moving on to our paired sinuses. So they are paired, so it's important to specify right from left in this case for all of the following sinuses. Starting with a transverse sinus that comes off from the confluence of sinuses, and it will terminate as the sigmoid sinus as it receives uh, another sinus which is known as the superior petrosal sinus, which is one of the sinuses that drain the cavernous sinus. The sigmoid sinus will continue in an S shape in a groove posteromedial to the mastoid air cells, and there it will form the jugular bulb, which will continue as the internal jugular vein. So here on the image over here, we have an MR venogram where we can see from the confluence of sinuses, the sinus coming off, heading laterally. It is the transverse sinus and it's on the left side, so it's the left transverse sinus. We are a bit lower down on this CT slice, and we are looking at the level of the mastoid air cells. We are in this posteromedial groove over here, and that is the sigmoid sinus on the right. We have here DSA images as well, digital subtraction and geography, and they are a bit delayed. So we are at the venous phase of the DSA, and here we can assess our venous system as well, and we can take a look at the venous sinuses and veins. So starting with the arrow pointing to this structure over here, this is running in the midline, and it is the superior sagittal sinus. Here we have a sinus that is heading transversely from the confluence, and that is the left transverse sinus. Here we are on the right side, and we are at the level of the sigmoid sinus. It has just formed the first part of the S shape of the sigmoid sinus. This is the confluence sinus, again seen just as we are seeing it here. A confluence, and here we are at the level of the right jugular bulb. So the first part just after the sigmoid that will continue as the internal jugular vein. Let's take a look now at the cavernous sinus, which is a special sinus because it has multiple septa within it, fibrous septa that will divide it into tiny small caves. And this is why it's called the cavernous sinus. It is located on either side of the pituitary fossa and the body of the sphenoid bone, and it contains several important structures. Let's see what it looks like on imaging. So this is the cavernous sinus over here and over here on either side of the pituitary fossa. This arrow is pointing to the left cavernous sinus, and this arrow is pointing to a structure within it that is actually an artery. You can see it's thick, it's bright, and that is the cavernous segment of the internal carotid artery, which Alisa showed you earlier. And as a reminder, what does the cavernous sinus contain? So along the lateral wall, you will find the oculomotor nerve, the trochlear nerve, and the V1 and V2 branches of thalamic and maxillary branch of the trigeminal nerve. More medially within the sinus, you will find the internal carotid artery, more specifically the cavernous segment, and you have the abducens nerve, which is cranial nerve 6. And the cavernous sinus is drained by two sinuses. So we've already seen the superior petrosal sinus, which will drain directly to the transverse sinus. And we have another one called the inferior petrosal sinus, which will drain directly to the jugular bulb. And on imaging, so this over here is a cavernous sinus. It's quite small, coming off it superiorly and headed to the transverse sinus. That is the superior petrosal sinus, and coming off it inferiorly and heading directly to the jugular bulb. That is the inferior petrosal sinus. Okay, now let's talk a bit about some of the relevant veins. We have one major vein that I want you to know about called the superficial middle cerebral vein, which courses along the Sylvian fissure. And it has connections to the dural venous sinuses. So there's a vein that comes off from it and goes superiorly to the superior sagittal sinus, and that is called the superior anastomotic vein of Trollard. And we have another vein that comes off it and heads inferiorly to join the transverse sinus, and that's called the inferior anastomotic vein of Flavey. And these will form connection between the superficial cerebral vein and the dural venous sinuses. Let's take a look at these two veins on an angiogram on a DSA image of the venous face. And we can see this large superficial vein over here. That's a superficial middle cerebral vein. There's this connection coming from it anteriorly, superiorly, coming off to the superior sagittal sinus. That is the superior anastomotic vein of Trollard. And there's another vein coming from it here inferiorly that is coming off to continue to the transverse sinus, and that's the inferior anastomotic vein of Lavey. So these can come up either on a DSA image or even on a CT image. So I would suggest you familiarize yourself with their appearances. Um, All right, moving on to the cranial nerves, I'll pass back to Alicia.
Thank you, Harut. That was great. All right, let's now go through the cranial nerves. So the human body has 12 pairs of cranial